Good evening, everyone. Today on Baby Chakra, uh, with the current pandemic that we are having, that is raging around and causing so much havoc, we decided to share some of the facts about COVID. Uh, as you all know, it has been more than a year since this COVID epidemic has affected the entire world. And by the end of November, we were seeing of 2020, we were seeing a lesser number of cases, and we hope that we will be getting out of this pandemic. Unfortunately, all of us relaxed and we were caught unawares with this second wave that has come. And if you look at the social media, the newspapers, the TV, or you are just in contact with your family, you would have realized that this wave of COVID is different from the previous wave, in that larger number of people are being affected. And when usually what happens is whenever there is a huge group that is involved, then invariably most of them, although they recover, 20% of them do fall sick. And when we have large number of people having COVID, then you will have a large number of people also who are sick. So coming to COVID and pregnancy as such, because I'm an obstetrician, I've been in this field for the past 30 years. So coming to COVID in pregnancy, there are some aspects that you should know. The chance of a pregnant woman getting COVID because she's pregnant is not increased. That means in a family, if there are 7-8 members, all of them are exposed to COVID, how much each member has a chance of becoming infected? Even the pregnant lady has only that much chance of being infected. But compared to other people who have COVID infection, pregnant women have slightly more complications. That is the reason pregnant women should be more careful and not get the infection. Number two, whenever there are comorbidities, that means the age is on the higher side, the woman is overweight, or she has some preceding medical illness like diabetes, hypertension, any autoimmune disorders, she is having a poor state of health, poor nutritional health previously, this COVID is going to be more severe in her. The good part is of the studies that have happened, and we have when COVID first started in and women were getting infected, we did not have any information. But we've been living with COVID for the past 1 year, so we have studies coming up on what are all going wrong in a pregnant woman who has COVID. And how do you know? Number one is if there is fever that is persisting with a flu-like illness, you're feeling extremely tired, you're having a sore throat, you're having dry hacking cough, you're having breathlessness on your routine work. If you previously could walk a little and you were not breathless, now that little amount of walking is making you breathless. Even when you're sitting, you are very, very conscious of your breath. You're feeling dizzy, you're feeling extremely fatigued, you're having lots of muscle pains. And some of the people with COVID, because it is affecting on the gastrointestinal tract, some people are manifesting as loose motions or loss of sense of smell or taste. These are the features that suspect us that this pregnant lady is having COVID. And the most important, history of travel, history of being in close contact, history of one of your family members or your contacts having COVID, being hospitalized, all these are risky factors. Now, the good part is that pregnant women are usually young, they are healthy. So, even COVID virus is another virus that infects our respiratory tract. It belongs to a group of viruses that are called influenza. So, they have a mild flu like illness, some amount of fever, body aches, sore throat, nose, and then the body immunity kicks in when the virus is replicating in our respiratory tract. The immunity recognizes that this virus is trying to invade us, and the inherent immunity that is there, if it kills off the virus before the virus spreads all over the body. Most of the women, around 80%, have just these little symptoms, and then the infection passes away. It is in 20% who, as I was telling you, are of poor health, have comorbidities, or are having an infection with a mutant which is highly infectious and highly destructive and highly replicative. That means the entire family is affected. Most of them are falling very sick. They are getting into the ICU. Some of them, especially the elder people, passed away. In that group of people, if that virus affects the pregnant women, we are seeing more amount of complications. So after exposure, within 5 days, the early flu-like symptoms will be there, but within another 3 to 4 days, these symptoms should pass away. Instead of that, if the fever is continuing to be high, if there is dry, hacking, continuous cough, if the woman is unable to keep the food down, she's having continuous vomitings, becoming breathless, then that is the time, instead of waiting and hoping that nothing will go wrong, it is time to have your testing done. It is time to consult your obstetrician. And if the tests nowadays have really come up, RT-PCR is there everywhere. Antigen-based tests are there. They do have their own limitations and sensitivities and specificity. So if an RT-PCR can be done, that is a reverse transcriptase polymerase chain reaction, where the virus particle, the nucleic acid is multiplied so many times and it is run through a test. So if the test comes positive, then this lady has symptomatic COVID infection. If there is an infection in pregnancy, we categorize people into mild, moderate, or severe. As long as the pregnant lady is on room air, not breathless, and has a respiratory rate, that means when we sit simply and count how many times we are taking a breath in a minute, that is called a respiratory rate. All of you must be very sure about the automatic pulse oximeters that are available. So you put into that and look at the saturation of the oxygen in the blood that is checked. If on room air, the oxygen saturation is more than 98, there is absolutely nothing to be done. For fever, take paracetamol, let your primary obstetrician know. It depends upon which part of pregnancy you are. If you're there after the organs are completed, that means at around 12 weeks of pregnancy, if there is an infection, we know that within 2 weeks, this infection will pass away as long as the woman does not fall very sick. So what is necessary is paracetamol, close monitoring, home isolation, good hydration, and monitoring and being in touch with your obstetrician. So what do we monitor at home? The temperature is to be taken with a thermometer, the pulse rate, the respiratory rate, the blood pressure, and the oxygen saturation. What we recommend is check a 6-minute walk test is very, very useful. So put on the pulse oximeter, sit calmly, check your saturation, Walk for 6 minutes and see if the respiratory rate is increasing, breathlessness is increasing, or there is a fall in saturation. This infection starts in the respiratory tract, affects the lungs. So, in the lungs, if there is no oxygenation happening, so when there is exertion, because the body demands more oxygen, the saturation will fall. So, at the earliest, you will have to go to a hospital which is taking care of COVID patients, and most of the states have helplines. You know where the bed availability is there, so you will need to go there. Once you go there, you will be triaged into is it a moderate infection, is it a severe infection, is it a critical infection, and based on that, the doctors there will look after you. The precautions we want in home isolation is that you should be in a well ventilated room with the door closed so that you don't infect the rest of the family members. You don't really need a family member in the room with you. You need to wear the mask at all times. You need to wear a triple layer mask, and the mask needs to be changed every 8 hours, and you need to discard it in a dilute bleaching powder solution so that that does not act as a fomite. On whichever, don't touch your mask. Whichever surface you touch, make sure you clean it up with dilute hydrogen peroxide or a sanitizer or bleach. Make sure that you wash your hands very frequently. Even with soap and water is good enough. You don't need to use strong chemicals, strong sanitizers, because we are seeing an increasing incidence of skin allergies with overuse of sanitizers. Make sure that you're monitoring and maintaining a chart of your temperature, of your pulse rate, of your respiratory rate, your blood pressure. Be alert if your baby is moving, and make sure you take your routine medications of iron, calcium, vitamin D supplementation, protein supplementation, whatever you're using. Make sure you take warm liquids. Don't take too many of these kashayams and things like that, because they're very irritant and they will cause you gastric irritation. Take lukewarm water with lime and honey if you don't have gestational diabetes. Make sure that you stay well hydrated. Do your deep breathing exercises and try to remain calm, because your mental stress is going to have an effect on the baby. If you're very close to delivery and your general condition is deteriorating, that is the only reason to deliver your baby prematurely. But otherwise, most of them do very well. And if hospitalization is necessary, oxygen supplementation along with the use of antibiotics for secondary infections, and some of the viral injections, a low dose steroid, injection of steroids for your baby lung maturity. And based on the necessity and compromise of your baby, if it is there, only then premature delivery will be done. What you need to remember is this infection, you need to hold on to and recover, because once the test is positive, in 2 weeks, most of the people do recover. It is only 20% that need hospitalization, and of them, only 2% become critical. Unfortunately, because everyone is stressed out and we are in such a panic mode, people are so confused, and we are seeing the effect of this mental stress and panic on the mothers and the babies. The government of India has recognized that as soon as the baby is born, even during lactation, the mothers can be vaccinated, so that the mother is protected and the baby is also protected because of the antibodies that go on in the breast milk. Entire family members, if they're available, vaccination is possible, do get yourselves vaccinated. Looking into the questions, I have a question from Christina. What are the complications of COVID during pregnancy? The complications of COVID during pregnancy are exactly the same of COVID infection in non-pregnant people. So the complications are having very high grade fever, having breathlessness and lung infection, having a cytokine storm, which is an inflammatory response and pushes your body to the limit, having secondary infections because of the steroids that were used in pregnancy. And as you all have been reading, having these unnecessary or overdosage of steroids that are not really supervised by a doctor is leading to increased fungal infection. Steroids definitely will increase the risk of having diabetes in pregnancy. So the blood sugars need to be monitored very well. And does COVID affect the baby in the womb? Right now, none of the studies are showing much effects. But what you need to remember is the baby is inside the womb in the mother. If the mother's general condition is not good, if she is falling sick, then the baby will definitely be affected. Rather than direct viral transmission through the placenta to the baby and the baby having COVID, what we are seeing more often is after the baby is born, because we are breathing in the same, baby is in close contact with the mother. So some amount of infections are happening. But if the mother has antibodies, these antibodies are also going to go into the baby and protect the baby. So once the baby is born, the mother takes vaccination and she is breastfeeding, that antibody is going to help the baby. And most of the studies are showing if COVID appropriate behavior, like as I was telling you, masking, making sure that hand wash is done, fomites are not spread, not touching the face, and babies are being breastfed to no complications. So till now, we do not have any reports that because of the COVID infection, the baby had congenital COVID infection and had any abnormalities. But we are in the pretty early stage and it is too early to tell what will be the long-term consequences. We have another question, 13 weeks pregnant, COVID positive, 8th day, what should I do? That's what I was telling you, Jyotsna. As long as you need to, depending upon your symptoms, you need to be, if you have just fever, you're not breathless, your pulse oximeter at home is showing good oxygen saturation, you need to take paracetamol, you need to hydrate yourself, you need to monitor your temperature, pulse rate, respiratory rate, saturation every 4 hourly and keep all through the day and keep a track. And do breathing exercises. Make sure that you take your routine medications. Make sure that you stay well hydrated, and self-isolation is what is necessary. You are saying it is the 8th day. If you wait for another 10 days, that will be around 18 days. That means 3 weeks after the infection, you're no longer infective. Take an appointment with your doctor after 3 weeks. Then have your routine antenatal checkup and an ultrasound. You will be doing well. It is very rare that this period of time is going to harm your baby. And I'm sure you will do well. Your baby will be growing well. Make sure that you are not too stressed out. Varsha has a question. Are pregnant women at a higher risk from COVID? As I was telling you, Pregnant women are not at a higher risk of having COVID. That means just because they're pregnant, it doesn't mean that the virus will infect them more often, but it has the same infectivity rate as the rest of the people. But in pregnancy, if there is COVID, there is a slightly higher chance that they will fall more ill. Should pregnant women be tested for COVID-19? If you're symptomatic, please get tested. If you don't have any symptoms, you're doing well, there is no need unless there is an intervention. That means we are doing now because some people will have such a mild infection that they do not recognize it, but the virus will replicate in them and they are a source of infection to others. So if an intervention is necessary, that means if you're getting admitted for delivery, you will be tested for COVID right now. Ashna Irani wants to know if the woman is tested positive for COVID, where and how would you suggest she deliver? So this is, there are all states are having their own helplines. Every place has coordination units. And in these units, they have a list of hospitals who will take care of COVID patients. And talking to the doctor there will give you a proper plan of a place for delivery. If it is more than 2 weeks, you can deliver with your obstetrician routinely. If it is within 2 weeks and you need an immediate delivery, only then you need to go to a hospital that is delivering COVID women. Otherwise, you can follow up with your routine obstetric care. Sonam wanted to know, there's a lot of questions on how to take care of pregnant women. Is there any dietary changes to be done? Dietary changes, Sonam, are what we've always advised. Eat healthy. So you need to make sure that there are lots of fruits, lots of vegetables, lots of dals, milk, curd, egg. If you take egg in your diet, eat home cooked food. Do not eat food that is reheated, reprocessed. Cut down the oily intake. And now most of the people are recognizing that natural innate immunity depends on having adequate B complex factors, adequate vitamin C, adequate vitamin D. So make sure that you have lime and honey in a glass of lukewarm water every day, and exercise in the sun for at least 10 minutes every day. If you're not able to exercise, make sure that your vitamin D supplements you do take by the or what is prescribed. There are no randomized trials that say that there will be an improvement if you're taking zinc supplements, B complex supplements, and all those. There is no as such harm in taking them, but they're not recommended because there is no proof that they work. What is most important is also your emotional health. Remember that babies are protected in utero because whatever goes to the baby passes through you. So if you're careful, your baby is one of the most protected persons under the sun. So make sure that you don't, you have social distancing, do not mingle with everyone, whatever, don't have any of these functions, because usually, traditionally, pregnant women, in the 3rd month, they go to their mother's place. In the 5th month, they come to their husband's place. Then in the 7th month, they have a ceremony, baby shower. So avoid all these. All these can be done once the pandemic is over. So if you really want it, do have a virtual meet. And one more thing is utilize the facilities of teleconsultation that are there. So most of the doctors are doing it. Your doctors, you can have a video call, you can whatever blood tests you have done, you can send them over, you can talk everything. And after your entire consultation, sending in your routine, whatever doubts you have, instead of sitting face to face and discussing, send them over to your doctor. And you can just go in for a checkup, have your ultrasound done, take your medicine prescription, come back home, and whatever doubts you have, you can do that. Before I end this session, what I want is pregnant women need minimum 4 checkups in pregnancy. So first one should be at around the 3rd month, 12 weeks, where you have your detailed blood tests, you have your ultrasound done, you have a screening for gestational diabetes, genetic markers. The 20 weeks, you need a detailed scan for growth and a checkup and a test for blood sugar. 28 weeks, you need to have your tetanus toxoid flu vaccination. 36 weeks, you need to have a checkup for growth, health of your baby, and your plan of delivery. So with just 4 checkups where you have all things done physically, and the rest of the time you can have your consultations on phone with home monitoring, taking your supplementations regularly, getting your blood test done, and doing your deep breathing exercises and looking after your health. So I think we have no more questions, and I will end this session here. And do follow us on Baby Chakra. I am also available on Baby Chakra. My referral code is, I think, PADV. And wishing you all a safe journey. What we've been telling right from the beginning: COVID appropriate behavior, respiratory hygiene, please follow them, because this is a airborne infection. All family members, as soon as it is possible and feasible, please get vaccinated. We are not yet recommending in pregnancy because we do have studies on pregnant women, and we hope to be having that soon. But once you deliver, do take your vaccination for protection for you and the baby. So I will end this session here. Thank you.